That's Dr. Lewis Clark, and I want to thank you for taking time to watch this video, especially if you or a loved one is suffering with a disc problem, a spinal disc problem, a bulging disc, a slip disc, or a herniated disc. All those different things can be described to basically say you have pain in your back, and maybe it's radiating into your pelvis or down into your legs, causing burning, numbness, tingling. Any of those things, if that applies to you, this next 5 minutes will help you understand what happened and some of the possibilities that are out there that are beyond just drugs or surgery or injection. So first of all, let's look at what normal anatomy in your spine looks like. You have bones, and you have discs, and you have nerves. So when everything is in a proper alignment, there is an opening here called a IVF, or intervertebral foramen, that allows the nerve to pass through and to go out to every part of the body and do what it does. Okay, so everything's perfect and normal. When you get a problem is when the disc begins to bulge outside of the edge of the vertebra and then begin to put pressure on the nerve. This is called a bulging disc. Okay, it's still contained within the outer part of the disc, which is called the annulus. It's made of cartilage, but the inner part, called the nucleus, is beginning to push through because the annulus is getting weak and maybe it's been injured. This can happen from chronic repetitive things like posture and repetitive movements, old injuries, but it also can happen from a new injury. And then we have the next level. When this thing progresses, as that annulus gets weaker, that cartilage gets weaker, and it pushes more and more up against it, eventually it can begin to be what's called a herniated nucleus pulposus. That is, the inner part of the disc is now herniated out of the annulus. It's no longer contained, and you've got more of a sharp pushing into the area where the nerve root goes, which can cause the nerve to be very inflamed, irritated, certainly painful. Okay, and so this is still contained at this level when it's called a herniation by a ligament that goes down the back of your spine called the posterior longitudinal ligament. You can have another condition called an extrusion, where it actually pushes through the ligament and gets in right up against the nerve, and obviously that's the worst of all of these, and sometimes the extrusion can even be separated. So the key to your recovery is finding out, number one, what is my actual problem? And how do you identify that? Well, a number of different ways: through neurologic tests, through orthopedic tests and chiropractic tests, looking at where you have your pain, what causes it, but then also looking at the x-rays. Because in an x-ray, a normal disc will be closer at the back and wider at the front, in the lumbar spine in particular. If you begin to see where the disc is opening up in the back where the nerve is, it's getting wider, that's not supposed to happen. If that happens, that is a very strong indication that you've got at least a bulging, possibly even a herniated disc at that point. So last resort is, obviously, if we can't identify and we can't correct the problem, then we could always get an MRI. But an MRI doesn't always tell you everything because it's not done weight bearing. So I prefer to find out through the exam, the history, and the x-rays. If it is a problem, begin a series of treatment, and if it responds to it, great, fantastic. We don't have to do any more imaging. And if not, then we can always get the imaging. So hopefully this helps you understand. I'm going to go into just a couple of options here now. What are our options as far as how do we correct this? Well, number one, repositioning the vertebra so that it sits down properly, takes the stress off the disc. That could be a fantastic option for you. But number two, if the disc is already bulging or already herniated, you're going to need to decompress the disc to get rid of the bulging area that you see here. So we do a treatment called spinal decompression, where we create a vacuum in the disc. We unload the disc to pull the disc bulge back in and to pull fluid back out of the bones back into the disc to give you a better height back again, like you're supposed to have, like this one would be, with the close in the back, wide in the front, good distance in between, and no bulging outside the bone. So those are options for you. If we can help you with that in any way, be sure and contact our office. And until the next video, I'll look forward to seeing you there. Live life well, and God bless.